Hi, I'm Cynthia Ribeiro, the manager and developer of the Advanced Neuromuscular Therapy program at the National Holistic Institute. This program was developed in 1994, so it's about 27 years old. I'm a massage therapist like you. So the idea here is the program will help you with pain management. That is the main goal, to prevent pain and rehabilitate pain. And the idea of understanding pain, there are two types of pain, chronic and acute. So we're going to talk a lot about that and the causes of that pain. Chronic pain until now was perceived as an input to the body, to the brain. Nowadays, research has proven that chronic pain is an output of the brain. And we go towards more of the biopsychosocial. Pain is more than just the body, it's the mind, and is also the surroundings of your life, your workspace, your family, your friends, and so on. The idea of understanding the body and understanding the person in a holistic way, that's why the name holistic is in our name of our school. The idea of understanding how the nervous system works and the importance of the nervous system. We have the central nervous system, which is the brain and the spinal cord, and then we have the peripheral nervous system, which will be two different types of nerve, the sensory and the motor nerve, and obviously there's an interneuron. I'm not going to get in details, but the idea is we have plexus, and so a plexus is a brachial plexus, for example, it controls the entire arm and it's coming from the cervical spine. The understanding of herniations, HMP, herniation of a nucleus pulposus, and so forth, how can that influence? That's a pathology, but it could be just a muscle mimicking that. So what the Neuromuscular Therapy program does, it will bring more information in accordance to that to you as we move on. So, as I was saying, we're going to be talking about the plexus, the peripheral nervous system. So the peripheral nervous system starts at a ganglion, at the root of the nerve, and I'm showing you that in a minute. The idea is it will divide like the branches of a tree, so you're going to have branches. Like our freeways, you have on-ramps and off-ramps, and you mix and match all of them, and so that's the idea. So the nerve impulse can travel from many different levels of the structure of the cervical spine, in this case because of the brachial plexus. We have a sensory nerve and a motor nerve. The idea of the sensory nerve is referred to as a dermatome. A dermatome is a cutaneous area that is innervated by a single nerve fiber. So a client might come complaining of numbness and tingling sensation at their fingers after a car accident, and that could simply be issue to the cervical spine at the level of C5, C6. But if you don't know that, you're going to try to rub that numbness and tingling out of their fingers. It's never going to happen. So understanding that and doing assessment is important. If a client comes complaining of weaknesses, we need to see, is there a herniation on the ventral part of the root of the nerve that is communicating with the motor nerve? In that case, the myotome, and that could be some of the weaknesses. The petit problema is that a knot can create those sensations also. So that's why we need to assess to find out what is causing that. As we proceed, we're going to be talking about the difference between joint dysfunction and myofascial pain and dysfunction. So finally, we got to the muscular system. And so the active tissue, right, and the idea of the inert tissue. So when we talk about myofascial pain and dysfunction, obviously the belly of the muscle, the sarcomere, and the fascia, because that covers the muscle, we're going to be doing a lot of techniques in accordance to that, hands-on wise. But we need to understand the difference between a myofascial pain and dysfunction and a joint dysfunction. And those soft tissues are very different in their behavior of functionality. Inert tissue surrounds a joint, is the house of a joint. It does not initiate movement, but it can prevent movement. So it supersedes often an issue of musculoskeletal injuries on the active tissue. which remember, fascia is active tissue. So neuromuscular, myofascial encompasses all. The idea of understanding how ligaments behave and capsular pattern creates our first collaboration with physical therapists and chiropractors and physiatrists and orthos and so forth. As I was talking about the nervous system, we need to find out if the nervous system is creating the dysfunction. So only now I'm getting to this because we need to do an assessment. So when you understand a ligament issue, for example, at the shoulder, you could have a separation of the AC joint, and that will be a ligamentous issue that will prevent you to cross your arm in front of your chest. Petit detail, the subscapularis muscle prevents you to do the same movement. Which one it is? Let's find out. So we will find out by understanding assessment. I'll give you a hint. When the person goes sideline, if the subscapularis is tight, the arm stays down. Just a little taste. And as we proceed, the muscular system, one of the things that is very important, this is my own personal chart. I love this chart. Guess what? Because of the side man. I stop the client sideline all sessions. It's a must because of the musculature here, and people tend to sleep sideline. We are gonna, in this program, we have 5 modules, and you're gonna be going from toes to nose, which is why, so we have shoulder thoracic, head and neck, lumbopelvic, upper extremity, and lower extremity. Every single part is important. And what causes the pain are physical forces of tension, compression, shear, bending, and torsion. And we have perpetuating factors, forces that can be constant. For example, one leg longer than the other. Some deviations, nutrition, psychology, good sports syndrome, a person who is always thinking that they are in severe pain and so forth. One of the most important things is people not feeling hurt. So we're going to get into myofascial, and I'm getting very excited. Now we are getting to the exciting part of the program. How the muscles have the capability to mimic associated pathologies in the musculoskeletal injury type of world and systemic conditions. Most of the aches and pains that our consumers experience are of musculoskeletal conditions, and they are created by mechanical motions because we tend not to prepare ourselves to perform. Anyhow, a trigger point, the most common trigger point is a latent. An active trigger point is when the person comes saying, I have a shoulder pain. So if they come complaining of a shoulder pain or I have a headache, for example, if they're talking about a headache, the SEM, the chicken muscle, the office athlete muscle, because it brings your head forward, can create aches and pains surrounding the eye. A person might think they have a cold. They come saying, my gland, because it creates a person to have watery eyes, runny nose, and so on. Tension headache and sinus headaches is what this muscle mimics. The idea of shoulder pain, so differentiating a myofascial pain and dysfunction, a neuromuscular injury, a trigger point, that is not an injury, by the way, mimicking a injury. So for example, a person comes complaining of shoulder pain anteriorly, it could be the biceps long head, but we don't know if it is the biceps long head that is in trouble. It could be that the infraspinatus is creating the referral pain onto the shoulder, and the person simply might have a tight muscle mimicking a rotator cuff tendinosis or the idea of a tenosynovitis of the biceps. So we need to do assessment. So for example, SPEEDS test is a test that we do for a biceps tendon long head for tenosynovitis. I don't assess, but I assess, but I don't diagnose, but I assess so I'm safe. And also it helps me to decide my strategy. I must educate my consumer that one session is not sufficient. We create a strategy to deal with the issues that they are complaining about so they are resolved, or we will know how far we can go to increase quality of life in chronic pain. But that is the idea. So I want to thank you for choosing to join us at this exciting venture from toes to nose of the human body, working in the non-pharmacological approach of pain as a neuromuscular therapy. Welcome to wellness and healthcare in an exciting time dealing with pain management, prevention, and rehabilitation of injuries, in collaboration with all kinds of healthcare providers. See you soon.